Okay, so this is one of the strangest cases I've ever seen, but I know you know that alcohol can make your vision blurry, but you probably didn't know that alcohol can actually give you a third eyeball. And in this case, I'm gonna show you how. So I walk into the room with this patient and he's staring back at me kind of bug-eyed, where one eye is just like way out in front and the other eye is in more of a normal position. And I'm just like trying to figure out what the heck is going on. And then he says something that makes even less sense to me. I'm basically like, what are you here for today? And he says, every time I drink peach schnapps, I can't see out of this eye. So this is a very odd case, but basically we have to evaluate this. And when somebody's bug-eyed, that means that the eye, one eye or both, is more forward in the eye socket than it should be. So you can imagine, if you look from the side, one eye is going to be popping out more than the other side, which is going to be more retracted back. And when that happens, that can put pressure on how the eye moves. So in this case, he wasn't able to move his eye normally, and how the eye tracks with the other side. So if the other side is moving totally normally, but one eye is not moving okay, you're gonna get double vision and everything's gonna be out of focus. The other thing that can happen sometimes is that when the eye pops out that far, it can actually pop out from behind the eyelids and cause severe pain. That's called subluxation. So basically, in this case, his eye was so far out from his eye socket that he's desperate to figure out what's going on and what could help. And he somehow has correlated this being worse when he drinks peach schnapps. So you get a CT scan, and a CT scan is basically a picture of bony and non-bony structures inside the body. And that is when I found the third eye blind eyeball. So if you look at the CT scan here, basically, he's got, on the left side of your image, you can see a nice circle, that's the first eye, his right eye. On the other side of the image, you can see another nice circle, that's his left eye. And in the middle, that cyclops looking thing is what looks like another eyeball. So how could this be possible that somebody would have a third eyeball in between their two normal eyeballs, but not be able to see out of it? So basically, what can happen is if you look at this CT scan, you can kind of see that there's some really thin bones here. And around the eye sockets, they're surrounded by our sinuses. So you've got the cheek sinus, and you've got sinuses here and in between the eyes going back towards the brain that are air-filled spaces that are almost like bumper of a car, like a crumple zone, so that if you get an injury like a sock to the face, that air-filled space is going to crack you, break your sinuses, but doesn't necessarily break important things like your eyeball. So in this case, he might have had some sort of an injury like that had broken a little opening or hole in one of these bones, because some of these bones, as you can see, are really, really thin. And when that happens, if you take an injury to that area and you have a little opening in the bone, some of the tissues from inside the nose, so as we all know, our inside of our nose has more of a mucus-lined tissue, that can just kind of sneak its way through that little opening in the bone and just kind of keep growing over time and kind of fill that space. And on top of that, if somebody has something that causes a lot of sinus congestion, whether that's seasonal allergies or an allergic reaction to a medication or a food, that can cause these tissues to continue to increase in size and form things like polyps or growths, normally inside the nose, but if they break in through an opening into the eye socket, these tissues can actually grow in the eye socket. And that's exactly what happened in this patient. He had something called a mucocele. So basically, this is a mucus-lined cyst that looks exactly like an eyeball on a CT scan. And it had gotten so big that it was pushing his eye, popping it out of the socket to where he couldn't really see, and it would swell up even worse when he got an exposure to something he probably had an allergy to, whether it was the type of alcohol or the peach and the peach schnapps. He should not have been drinking peach schnapps. I'm not sure why anybody drinks peach schnapps, but in this case, it was definitely a bad idea. So crazy thing about this is that his vision was perfectly normal. We were able to go in through the nose, didn't have to make any incisions on the face, to be able to go in, find this little area where this mucus tissue had wedged its way into the eye socket, drain that cyst from the inside of the nose, and then those tissues kind of collapse on themselves and shrivel. And so that mucocele, that large mucus-filled cyst that he had, drained internally, shriveled back down, and in turn, his eye went back into his eye socket. He was able to move his eye again, and his vision was okay. I did tell him it would probably be a bad idea to continue drinking peach schnapps for a variety of reasons, but in this case, for some reason, that was causing some inflammation on those nasal tissues and causing that area to pop into the eye socket and swell. So if you're thinking about drinking peach schnapps, just make sure that you haven't had an injury inside your eye before that would give you a blind third eyeball. If you like this story, please feel free to subscribe to our channel or comment below. We'll have more stories of cases that we see in the future.